Hello. In this video we will know: what is case control study? Fundamentals of case control study. Design for case control study. Selection of cases and controls. Biases in case control study. In case control study, the investigator selects the case and the control group on the basis of the outcome, meaning that individuals with the disease of interest and those who are healthy. Cases and controls are assembled and are questioned, or their medical records are consulted regarding past exposure to risk factors. Fundamentals of case control study. Cases and controls are selected on the basis of disease status. Outcome of case control study is exposure status in both cases and controls. Measure of association for case control study is odds ratio. Case control study is conducted when disease is rare. Direction of case control study is from disease to exposure. Design for case control study is shown in this slide, where population is identified with cases. Means individuals with disease, and the controls that do not have disease. In the case we check if the individual has been exposed to the risk factors in the past. Also we check if the individual has not been exposed to the risk factors. Similarly in controls, means that do not have disease, we check if the individual has been exposed or not exposed to the risk factors in the past. Identify population and follow to see whether disease develops in cases and controls of exposed and unexposed group. Then calculate and compare the odds of exposure in cases and the odds of exposure in control group. Finally, the odds ratio is calculated by the formula odds of exposure in cases divided by odds of exposure in control group. If we take an example of this format, we will first identify population and follow to see whether the breast cancer is diagnosed or not in smokers and non-smokers group. Then compare the odds of exposure in cases and the odds of exposure in control group. Finally, odds ratio is calculated with the help of above formula, and we get 2.2. This shows that smokers have 2.2 greater chance to develop cancer than non-smokers. Advantages of case control studies. Case control studies are inexpensive and quick to perform. It is useful when the disease being studied is rare or for a condition which develops over a long time. It can evaluate multiple etiologies for one outcome. Disadvantages include recall bias and selection bias. Selection of cases can be selected from hospitalized patients, patients in physicians' practices, registries. Selection of controls can be selected from non-hospitalized persons living in the community similar to cases, hospitalized patients admitted for diseases other than that for which cases are admitted. Biases in case control study are selection bias and recall bias. Thank you for watching, and don't forget to subscribe.